This party's fundamental approach to the health and social care services is exactly the same as the principles on which the NHS was founded. Health and social care must be publicly funded, person-centred, effective and free at the point of delivery. Health and well-being is much more than the absence of sickness, and the health and social care service must be much more than an intervening when problems arise. Exercise and diet are important factors in mental and physical well-being, but there are many others. Quality of life, meaningful and secure employment, warm, well-built and affordable housing, educational attainment, and the ability and wherewithal to socialise, a clean environment and the absence of stress and insecurity are all equally important. Health, well-being and social care transcend all areas of our lives. They should also transcend all areas of public policy. A person's life expectancy can depend as much on their postcode as on their lifestyle. Take a bus journey from Belfast city centre to the suburbs of BT9, and life expectancy increases with every bus stop. As levels of life expectancy in areas of high deprivation fail to keep up with more affluent areas, the life expectancy gap increases. The factors which most influence early death include unemployment, income, health, education, access to services, living environment, and crime and disorder. Health and social care services should be provided as close to people's homes as possible and appropriate. Hospitals should be a last resort. Community-based diagnostic and follow-up facilities must be further developed, funded and supported. There is no reason, technically, medically or ethically, why the majority of hospitals-based tests cannot be carried out in the community. Mental health services have made real progress in recent years in supporting people outside hospital. That work must continue. It is as inconceivable as it is inexcusable that in the 21st century, the best we can offer the elderly and infirm of our society is a place in a nursing home. Given the choice, most people would prefer to be in their own homes. Again, there is no reason, given the funding, the will and the imagination, that many more person-centred services for the elderly and others cannot be provided safely and effectively at home. Maternity services in Northern Ireland are under-resourced and undervalued. We need to see an increase in the number of natural births and a progressive reduction in the number of babies delivered by caesarean section. There is a proven need for additional midwifery-led units and the rollout of access to the specialist midwifery-led services across Northern Ireland to work with those families most in need of help. There were 2,606 children in care in Northern Ireland last year. Almost 1,700 were cared for by foster parents. Foster parents and others providing care fulfill a crucial role, both for the children they care for and for this society as a whole. Yet foster care allowances do not reflect the contribution, nor do they adequately provide for the needs of the child or the foster family. As an initial upgrading of the support available to foster carers, we want to see that allowance doubled. Women in Northern Ireland suffer more years of ill mental health than others in the UK. Doctors in Northern Ireland prescribe antidepressants at the second highest rate in Europe. 71% of children with autism have at least one co-occurring mental health problem, while 40% have two or more. More children in Northern Ireland per head of population provide care to their families than in the rest of the UK. These are the realities. Over half of all adult deaths in Northern Ireland are caused by three main diseases: cancer, heart disease and stroke. There must be a strategic and coordinated approach to reducing the incidence of preventable cancers, improving access to screening and achieving earlier diagnosis. The campaign of public awareness about the recognition of early signs and symptoms of stroke should be prolonged and developed. Heart patients discharged from hospital must have access to appropriate cardiac rehabilitation services to allow them to continue to recover, come to terms with their new situation, and return to full life where possible. The number of people here living with dementia is increasing year on year. Early diagnosis and appropriate intervention would help better manage the symptoms and improve people's quality of life. Further development and extension of the number of excellent community-based supported living schemes would also become a priority. Dementia strategy for Northern Ireland should have been launched earlier this year. Its proposal should now be implemented and funded immediately as a necessary but first step in the development of local dementia services. 1 in 4 of us will experience mental health problems at some stage in our life. Levels of mental health in Northern Ireland are higher than elsewhere in the UK. The Bamford Review of Mental Health Services here concluded in 2007. Its recommendations should now be implemented immediately. The Assembly must also address the historic underfunding of mental health services, the gap in services which still exists, and the need to specifically fund. Support, develop, and talking therapies and counselling services. Mental health awareness and protection, particularly among young people, must remain a funded and targeted priority. Understanding that seeking early help is vitally important must be supported by the resources and the services to tackle mental ill health and suicide. For many members of the ethnic minorities in Northern Ireland, access to health and social care services can be hindered and prevented by language barriers, difficulties registering with a GP, and the lack of cultural sensitivity. Some minority ethnic groups can be at greater risks from diabetes, hypertension, stroke, or coronary artery disease and mental health problems. Ethnic minorities should be involved directly in identifying health and social care issues and in the development of specific health promotions and awareness programmes. The party's health and social care policy must address all these issues and more. Among the immediate priorities must be abandoning the McKinsey report, reconstituting and broadening the current review of health and social care, free social care for older people in nursing and residential care, full implementation of the Bamford Review and mental health services, the launch and implementation of the Northern Ireland Dementia Strategy, the reintroduction of free eye tests, universal NHS dental treatment, a programme of public health initiatives to address health inequities and most vulnerable communities, and an Assembly committed to the health and the social care services that is publicly funded, person-centred, effective and free at the point of delivery. Thank you.
Do we need to defend the NHS? I think yes, defend the NHS. It's an important concept and practical reality of the benefits of public service, of collective action against individual need or individual greed. It's an essential advancement of the social movement and labour movement over many years, and always the one that's always first in the attack line when it needs some cuts. But in defending the NHS, I think as a party we need to be honest about the possible failings and weaknesses of the NHS, of the problems the NHS has had over many years, and the failings of the NHS to respond to the needs of people in the community as opposed to the people who run the NHS. The failure really is in the senior management in the health service and the political lack of courage and imagination to genuinely get beyond lip service and commit to health promotion and look at why modern life has produced so much ill health. Not to take the easy option led by pharmaceutical companies, but to look at genuine health promotion, which is not pharmaceutical-led or technology-led. It's about the integration of life, community life, where health and recreation and mental and cultural activities other than alcohol abuse consumerism and junk television. Thank you.
I'm Rita Hughes. I work for the Royal College of Midwives. It's the professional body, but also the trade union for midwives throughout the UK. And in fact, we work very closely with the Irish Nurses and Midwives organisation in the Republic as well. The health service is something that all of us at different times in our life dip in and out of as required. Joe, 2 weeks ago. Do you know what? Everybody gets born. So maternity services are a fundamental part of the health service. And here in Northern Ireland, we have the opportunity at the minute for every one of us to contribute to a consultation that's going to set the blueprint for maternity services here for the foreseeable future. And your policy paper echoes all the things that are in that consultation. Maternity care should be provided close to where the woman lives. She shouldn't have to travel. She's not sick in the vast majority of cases, and she doesn't need to go to a hospital. She can see a midwife anywhere in her local community. We need to focus on trying to get birth normalised again. Why is it that 1 in every 3 women in Northern Ireland give birth by caesarean section? And it's about 1 in 5 south of the border. 100 miles doesn't make a big difference to the shape of your pelvis, you know. So there's something to be done about working on that. So I would ask people to go into the DHSSPS website, go into the bit that says current consultations, and have a look at the strategy. It is an excellent blueprint for the way forward. But we don't want any ministers getting nervous wobbles somewhere along the line between publishing a consultation and implementing what it says. It needs the support of people out here on the ground to write back, to comment, to do whatever way you feel you can respond. And this is a good thing, and let's move it forward. One of the most, I suppose, interesting bits for us is the focus. Everybody says the Bamford Review should be implemented. 50 women a year in Northern Ireland develop serious psychotic mental illness, generally after the birth of their baby, but sometimes during the pregnancy. They need to be hospitalised. And we have women here in Belfast being hospitalised in Derry, and their family, their husband, their partner, are left with a brand new baby because they don't have one single, on the island of Ireland, we don't have one single bed to admit a woman alongside her baby, and that is a disgrace. And so if you're going to comment on the consultation, it would be very helpful if we can get in there the need for proper inpatient mental health services for pregnant women. So on a final note, in terms of money, picking up on Ian's point, our consultant medical colleagues in Northern Ireland, between them, get £11 million a year in bonuses for turning up to work and doing their job well. There's not another single member of the health service staff in Northern Ireland that's that well. Keep that in mind as well.
I just want to pick up on one piece that Gemma identified as a major issue, and that's about the provision of services close or closer to people's homes. There is no reason, as she said, why that cannot be done. And I think, and this is a point that Ian made as well, and Rita alluded to as well, there is a tension between those who are delivering the service and those who are managing the service. And I think that there is a major piece of work for us to do in association with health service workers, with trade unions, with the professional body and with the community, to reclaim the delivery and direction of health and social care from the bureaucratic stranglehold that it's got into in recent years. Northern Ireland presents some of the best, in fact the best exemplars of how health and social care should be provided, not just in these islands, but I suspect in some areas in the world.
We'll move on then to our next policy discussion document, and I call upon Kat McNally to introduce the document on education.
Comrades,